Welcome to ImmTrac2, Disasters, Part 1, Adding Disaster Consents and Clients. What is a disaster? First, let's define what a disaster is. Disasters have a definite beginning and ending date determined by a governmental authority, a specified geographic area, such as a county or state, specific aims, antivirals, immunizations, and/or medications associated with the disaster, and optionally may have priority groups. Some disasters require priority groups, but not all do. Priority groups can protect those at risk, such as those essential to the pandemic response, those who care for the ill, those who maintain national security and community services, children and pregnant women, and workers at greater risk of infection. According to Section 161.00705 of the Texas Health and Safety Code, any antiviral, immunization, or medication, an AIM, administered in response to a declared disaster or emergency must be entered into the Texas Immunization Registry, ImmTrac2. According to Section 100.7b of the Texas Administrative Code, a healthcare provider who administers an antiviral, immunization, or medication, an AIM, during a publicly declared disaster shall provide the data elements to the Department, DSHS, within 30 days of that medical treatment, in a format and manner prescribed by the Department. Report COVID-19 immunizations within 24 hours after administration. This is a requirement by the Centers for Disease Control and Prevention, the CDC. This requirement is especially important for clients who are deceased before their client records are closed permanently by vital statistics. Reporting requirements. Everyone who receives an AIM during a declared disaster will have their AIM reported to the registry, regardless of whether they signed a consent or not. The next section is about consents and client types. Disaster information retention consents are also known as disaster consents. All disaster AIMs must be recorded in the registry with or without a disaster consent, but disaster consents allow the registry to keep a client's disaster AIMs longer than 5 years if a disaster client has not signed a disaster consent within 5 years after the end of the disaster. Their disaster AIM is deleted. Disaster consents only affect disaster AIMs. Standard consents. Standard consents, which are ImmTrac Child, IC, or ImmTrac Adult, IA, consents, allow the registry to keep standard non-disaster immunizations only. Standard consents only affect standard immunizations. ImmTrac Child is client type IC. For this client type, the client is under 18 years of age, a parent or guardian signed a minor consent for the child. The registry can keep standard non-disaster immunizations until 18, and a standard consent does not have any effect on keeping disaster AIMs in the registry. ImmTrac Adult is client type IA. For this client type, the client is 18 years of age or older. The adult consent was signed by them or a guardian in some cases. The registry can keep standard non-disaster immunizations for life. If signed before age 26, any childhood immunizations are kept, and an adult consent does not have any effect on keeping disaster AIMs in the registry. The disaster unconsented client type is type DU. There is no age limit to client type DU. No consent was signed by the client. This type of client must have been in a disaster and received an AIM to be in the registry. Since a standard consent was not signed, they cannot keep any standard non-disaster immunization in the registry, and disaster AIMs are kept for 5 years in the registry. If a disaster consent is not signed within that time, their disaster AIMs are deleted at the end of 5 years. If you enter a disaster unconsented client and do not add a disaster immunization for that client that day, the client record will be deleted that night. The disaster consented client type is DC. For this client type, there is no age limit. A disaster information retention consent form was signed by the client, or if under 18, signed by a parent or guardian. They did not sign a standard IC or IA consent. Because they did not sign a standard consent, the registry cannot keep their standard non-disaster immunizations in the registry, but since they signed a disaster consent, the registry can keep their disaster AIMs for life. To review, there are 4 client types. The parent or guardian of the ImmTrac child sign a minor consent, and the registry can keep standard immunizations for that child until the age of 18 or longer if the child signs an adult consent after reaching 18. An ImmTrac adult signed an adult consent at the age of 18 or older, and the registry can keep standard immunizations for that adult for life. A disaster unconsented client didn't sign anything, and the registry can keep that client's disaster AIMs for only 5 years unless a disaster consent is signed. A disaster consented client signed a disaster consent, and the registry can keep that client's disaster AIMs for life. The next section provides an example with Andrea's story. At birth, Andrea's parents signed an ImmTrac child, an IC consent for her. What does an ImmTrac child consent mean? Immunizations the registry receives for Andrea will be kept until Andrea reaches 18 or the consent is withdrawn. At 18, Andrea signed an ImmTrac adult, an IA consent. What does an ImmTrac adult consent mean? Since Andrea signed an ImmTrac adult consent before 26, her childhood immunizations are kept in the registry, in addition to any adult immunizations she gets. The registry will keep Andrea's immunization records for life, unless she sends a signed withdrawal form to the registry. At 30, Andrea was in a disaster, got an AIM, and signed a disaster consent. Since Andrea signed a disaster consent, her disaster immunizations will be kept longer than 5 years after the end of the disaster. Can Andrea have both a disaster consent and a non-disaster consent? Yes, Andrea already had an ImmTrac adult, an IA consent, so the registry stores her non-disaster immunizations. Andrea also received a disaster immunization and signed a disaster consent, DC, so the registry can keep her disaster immunizations longer than 5 years beyond the end of the disaster. Getting started. Who enters the disaster dose? The organization that administered the AIM is responsible for reporting each dose to ImmTrac2. For a browser, we recommend Google Chrome. AIMs must be entered by the correct administering provider/facility. For subsites, log in using the organization code of your subsite provider/facility, not the org code of the parent site. Be extra careful when you are logging in to use the correct org code. Some users have access to multiple org codes. Logging in with an incorrect org code can add patients and immunizations to the wrong organization and prevent the vaccine inventory from being correctly decremented in the vaccine allocation and ordering system. After logging in, and before adding consents, clients, or immunizations, look at the menu bar at the top of the screen to check the name of the organization that you're logged into. To select or create a client, from the menu panel, click Enter New Client, which will search to see if the client already exists in the registry. Search to see if the client already exists in the registry by doing a smart search. Required fields for a smart search include first name, last name, birth date, gender, and street address. Be extra careful to correctly enter the date of birth. An incorrect date of birth can make the difference between the client seen as a minor or adult, or you may not see a client that already exists in the database and create a duplicate. It's easy to make this mistake and transpose numbers. If the client's address in ImmTrac2 does not match the provider's EMR records, please update ImmTrac2 with the client's current address. Updates to your EMR are encouraged. When adding a new client, please select the race and ethnicity of the client in the Client Information tab. The next section describes how to enter consents. If the disaster client is found, click on the ImmTrac2 ID on the left side to go to the client's record and add a consent to the existing record. If the client is not found, we can use the buttons on the bottom half of this screen to add a client record and a consent. Next, we will discuss the 4 mutually exclusive buttons on the bottom half of the screen. You can only choose one of the 4 buttons. If you have a standard ImmTrac2 consent, such as an ImmTrac Child IC or ImmTrac Adult IA consent, click this button labeled Add a Client. If you also have a signed disaster-related consent from the client, you can add it later when you're confirming consents. The button labeled Request a Consent Form that is highlighted allows you to request and print a consent form that is pre-populated with the client's information which you entered in the search screen earlier. Use the button labeled With Signed Disaster-Related Consent if you're adding a disaster-related consent but not a standard consent. Use the button labeled Without Signed Disaster-Related Consent if the client did not sign a disaster-related consent and does not have a standard consent either. This is the end of ImmTrac2, Disasters Part 1, Adding Disaster Consents and Clients. To learn more, consider viewing ImmTrac2, Disasters Part 2, The Tales of 5 Disaster Clients. Thank you from all of us at the Texas Immunization Registry.